Hey guys, Dr. Christy Ennis. If you've ever had back pain, hip pain, pelvic pain that won't go away, or incontinence that won't go away, a tight pelvic floor can actually be to blame, and doing kegels can actually make that worse. So the pelvic floor, the first thing to know is that everybody has one, men and women. I get that question a lot, as a matter of fact, but yes, both men and women have a pelvic floor, and it truly forms the floor of your pelvis, starting from the pubic bone and going all the way back to the coccyx. A whole sling, basically, of muscles there. And you also have a hip muscle called your obturator internus, which rotates or brings that leg out. That also acts as a pelvic floor muscle. And then your iliopsoas, a hip flexor muscle, has attachments through the fascia in there as well. Now, what the heck do these muscles do? Well, they have a few very important jobs. Number one, they tighten up so that things don't come out. That would be your internal organs, urine, gas, right? So if you've ever had to hold in that little toot, you got to squeeze those muscles a little bit. Stool, and they also function in a sexual function with erection of both the penis and the clitoris. So that's a pretty important thing right there if they're not working the right way. Now they also work to let things in and to let things out. So in order to actually have a bowel movement and to urinate, those muscles have to relax. And that same thing holds true with getting anything in there, right? Whether it's from a sexual standpoint or whether you need to use a tampon. Those muscles have to be relaxed enough, again, in order to let things come through. And I know that this is a very sensitive topic, so if you don't feel comfortable leaving comments below, please feel free to email me. It's a little bit more private that way, and I'd be happy to answer things there. Now, a lot of times people think, okay, well, whatever's going on in there, it must just be because things are tight, 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 right? Here's the thing. You can actually have tightness and weakness at the same time. So go-to is just give people kegels when they've got that incontinence going on. But if you actually have tightness there, trying to strengthen that isn't going to help you out. So I'll give you an example. You can see can't see my pelvic floor muscles. You can see the bicep. So if I were to walk around with my bicep kind of half working, right, all day long, it's going to get really tired. So if I were to put a 10-pound weight in there and say, okay, now it's time to do my curls, it's going to go, right? So you got to work on getting it to relax to where it's supposed to be first before you try to strengthen it. If you really are not sure after I go through some of the explanations as to what you can look for to know if it's tight, make sure you check with your pelvic floor therapist, which is one of the things that I do as well. So here we go, some signs that you might have actual tightness in there. Number one is actually posture. So if you're somebody, and I see this in guys a lot, who sits like this, you're trying to relax that pelvic floor really and truly by bringing those legs wide and posterior tilting of that pelvis. And like I said, I see that in guys a lot more than girls, but that's a very, very big one. Number two, if you have any type of chronic pain, especially headache and jaw pain, that means you have kind of an overall tension in the body. And believe it or not, that tends to then cause tension also in the pelvic floor. Any history of childbirth, period, but especially childbirth trauma, or even abdominal surgeries. So any of these scars that are in the abdomen, whether it's from child trauma or not, can cause some fascial and muscle tightening in there. And you'll know if you push on that scar and it's a little tender, that's a good indication too. Any type of constipation or bowel disorder. So if you're someone that really just can't go to the bathroom, right? A lot of times there is that issue with the pelvic floor muscles. Erectile dysfunction, not something that's talked about very much with those muscles, but remember what I said in the beginning, those muscles have to work in order to really support that erection. So they're really, really important. If they're really too tight, they're going to restrict that blood flow and it's not going to happen. Also, any of those other kind of pain issues that you might hear diagnosed, like dyspareunia, which is pain with insertion, and interstitial cystitis. I know these are all big words, but you may have gotten these diagnoses at some point and have no idea, right, what these are from. Chronic hip and back pain, especially where You know, there's nothing that's showing up on the x-ray or an MRI, but it doesn't matter what you do, you just can't get that pain to go away. Sometimes that pelvic floor is the missing link. And then lastly, I know we're all guilty of this at least at some point in time, is just not going to the bathroom. So if normal going to the bathroom is every 2 to 4 hours, if you hold that for a really long period of time, those muscles are just like working overtime. It's almost like a Hulk sound. They're working overtime to help support things. So it is important to actually let yourself go to the bathroom. And then I know I said lastly, but other thing that goes with that is actually hovering on the toilet. So you have to let yourself relax on the toilet in order for those muscles to relax too, so that you can actually go to the bathroom. And if you don't, you end up leaving a little bit of residual tension that's in there. Now, what the heck do you do about this? Number one is actually just kind of doing a little assessment of where things are. So I often will have people use a towel. This is such a pretty one. You don't have to, it doesn't have to be as pretty as this, but rolled up, and you're actually going to sit right on that. And you're going to do a little just pelvic clock. So I'll have people do a little pelvic tilt, posterior, to the side, anterior, right? So you're tipping that bowl, other side and forward. And the towel is there so that you can get a sensation of, okay, I feel pressure there, I feel pressure there. Remember I said, right, pubic bone to coccyx, so we want to get a sense of where those things are. Now, after you've done that, you actually want to let yourself, not fart, but just relax right onto that towel. That gives, again, a sensation of, okay, that's kind of what relaxed feels like. So sometimes that's hard to do because we're all used to being, right, kind of sucked in and pulled in. So it's easiest if you kind of take a deep breath and then, don't worry, no one's watching. Let everything just bloop. Try not to have terrible posture, but try to let that stomach just bloop out. And then you should get that sensation against the towel of, oh yeah, okay, there that is. So that's just kind of the basics of getting the sense of that feel. Number two, and it's really important, is diaphragm breathing. Diaphragm breathing actually helps to relax the nervous system and relax those pelvic floor muscles, which is why it's really important. So typically when I'm having people do this, I have them place one hand on the rib cage and one hand on the belly, and you want to think about actually filling that belly up. So as I breathe in, instead of a suck in, the belly actually moves out. So it kind of looks like this. It's in and out. Trying to get as little movement from the rib cage as possible. Of course, you'll get some, and that's okay. But really, sometimes, one more here. Sitting is a little bit challenging, so sometimes you really do need to do this one lying down and just let everything relax. After you've worked on breathing a little bit, and again, remember you can do that lying down too, we're going to actually get some releases and stretches into those external muscles that affect that pelvic floor. That first one is that obturator internus muscle. So its job is to, like I said, rotate that leg out. So to get the opposite, we want to, right, go in with it. So the easiest way I found to do this, if we're stretching out actually the left side, is crossing the right leg over as much as you can, and then you're actually dropping your legs to the right side. You can do whatever you want with your arms, but this is getting those deep muscles in the hip. And I usually tell people, try to breathe, work on your diaphragm breathing here, but 3 to 5 nice breaths there, okay? From there, we want to work on those hip flexor muscles. And a lot of times we need to do a little bit of a release in there first. So I'm going to use the Derma Edge. The edge is just easier, way easier for me to use than my knuckle. I'm going to find a tight spot. So if you find the top of your hip and kind of drop down, you'll find one if it's tight, trust me. Sometimes that spot is right alongside the inside of the hip too. And I have another video I can link to show you more of that. But find that spot, and then you're going to do just a little heel slide. It's a little bit of pin and stretch into that muscle to help it release a little bit more. And then it usually becomes a little easier to stretch. So you do this until you go, hey, that doesn't feel so bad anymore. From there, you'll go into that hip flexor stretch. I find the best way to stretch this one is a kneeling position. Now you can always do this standing if it's uncomfortable for you to kneel, or put a mat or a pillow down there too. But to stretch out this left leg, right leg's gonna go in front. And this is not about balance, so please feel free to hold on. You're gonna do a little pelvic tuck, squeeze into the glute, and then from there, you just need to move a little bit forward so that you're actually getting those muscles. You don't wanna lose either that glute squeeze or that tuck. Otherwise, you're stretching something else, really. And again, 3 to 5 breaths if you can. So those are all external things. There's one more that I'm not going to demonstrate, but I am going to briefly talk about, called progressive relaxation. And that really is where you tighten up muscles and let them go. You can go foot to head or head to foot, and you just squeeze and tighten and then let go. And that really does a good job of relaxing the whole system. And I can link, there's a bunch of videos on YouTube about that, certainly. And then lastly, like I said, these are all external techniques. If you need to actually have internal work, you certainly can, like I said, check out who a local pelvic floor therapist is in the area. And I do have a couple videos that I'll also link that talk about some internal work that you can do on your own. So thank you so much for tuning in. Don't forget, you can please email me if you have any questions. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.